Welcome back to Preserve Health Talks. We're pleased to have Dr. Stuart Shipe, traditional Chinese medicine. Perhaps an alternative approach to what we normally talk about, but it's certainly worthy of having you as a guest. And we're here to talk about acupuncture. So welcome, Dr. Shipe.
I love talking about that most. And I would say we're getting today, as traditional Chinese medicine, acupuncture becomes more and more mainstream. Instead of being more alternative, it's being integrated medicine, being integrated into our medical model as another modality to assist and to help people in healing that maybe we didn't think about before.
Tell us a little bit about your training, what drew you to acupuncture, and how did your journey in this field begin?
It's been a long story, but I'm going to keep it short. So I've been a registered pharmacist for the last 40 years and worked in long-term care as a consultant pharmacist, surgical centers. And that was the majority of my work, is long-term care, and every day going in and writing recommendations for drug therapy and seeing the patients. It hit me in the heart, and I just said, these folks are taking 16, 17 drugs, and despite a lot of recommendations, their health continues to debilitate. And I said, there's got to be a better way to health than this. And was talking to a friend, and he goes, why don't you go up and see that Taiwanese physician up in Cocoa Beach? He has a small school, and check him out. I already talked to him. He said you can go up and shadow, him for the day. And I was like, wow, that was really a gracious, favor, extended. So I was like, I don't know, though. It sounds like voodoo medicine or something like that. As a pharmacist, I had no idea about what I was getting involved in. Went up there, and he was kind. He was a gracious physician. And so I remember after seeing treatment after treatment and the good results, I had a lady that was probably in her 70s walk in with a cane, and she was you could tell she was in excruciating pain. She got up on the table. He asked her questions, performed acupuncture. When we walked back into the room to take the needles out, he took the needles out and he walked out of the room. But I stayed behind to try and help her up off the table, and she started getting up and she started crying. And I'm like, oh my gosh, he hurt her. What am I gonna say to the doc? And I was like, Anna, are you all right? And she goes, I haven't been out of pain in 15 years. And I was like, wow, that was very powerful. I was like, I can't do that with ibuprofen or, a lot of medications. And the next day I enrolled in his school. And from that became a journey, getting my master's degree in Orlando and then going out to Oregon and getting my doctorate, then doing my rotations in Shanghai and Beijing University.
Wow.
So, it's been quite a journey. And the breadth of what I thought acupuncture was about has totally transformed my life, and then working with docs like you, and sharing patients at what can we do to improve our medicine. I had a lady, for instance, that came into me for hot flashes, and she said, you got to help me. Just bought a business here, late 70s. She goes, I'm not going through menopause again. And I was like, no, we probably should just get this checked out. I usually don't do a lot of blood pressure, but I put a blood pressure cuff on her. And she, and it said E. You ever had that happen? Electronic blood, and it said E, and I'm like, oh, this machine must be not working. And so I did it again, got another E. So I did the old school way, sphygmomanometer and stethoscope, and took her blood pressure. I think she was like 220 over 110, 115. I was like, you are about ready for a blowout, and this is not something traditional Chinese medicine is really adept at. Made a phone call and got her into a doc, and she was on an alpha blocker that day to get the blood pressure down and under control. So that's what we need to do. We need to work together to further health.
Yeah. So for someone who's never tried acupuncture, how would you describe it and what it does in the body?
Acupuncture is like, the best analogy I can make is the Chinese believe that we have a vital life force, and they called it qi, Qi or Chi. And we know that there's a nourishing substance in the body called blood, or they call it blood. As that qi and blood flows through the entire body unobstructed, you have health and no disease. You have absolute no pain, no disease. It's when they believe this blockage occurs in this circulation of energy or blood, it gives you this imbalance, this malfunctioning in the body, and that malfunction ultimately, if it's not repaired, turns into a disease, syndrome, and then symptoms. So acupuncture is kind of the process of, if you have tried to water a garden with a garden hose that had a kink in it, how well is that going to go for the garden eventually, right?
Right.
So my job is just to find out where the kink in the hose is, release that blockage in the body, and the body already knows how to heal and let it do its thing. It became diseased because something affected its balance. So Chinese medicine is just about trying to balance the individual.
Yeah, the whole word disease is a very interesting word.
The dis-ease, right?
Yes, ill at ease.
Yes.
And
yeah.
that kind of feeds into what you're saying.
Exactly. We really focus a lot, and we have amazing Western technologies. We focus a lot on symptomology. But as we're learning, even in Western medicine, even in functional medicine now, that it's not just about trying to help the symptom, right? It's about trying to fix the reason why that symptom is there, the root cause of that. And if we just end up just taking care of symptoms all the time and not really investigating that root cause, then the symptoms end up coming back and coming back and coming back again. So this integration is a great thing to help identify root cause analysis of disease. Now we have like pharmacology has jumped in with evidence, not only evidence-based medicine, but this individualized, personalized medicine, right? That we were just speaking before the show about gene therapy and being able to look and see what are we predisposed to as far as genetic hiccups, right?
What's the difference between dry needling and acupuncture?
Actually, that is the same in traditional Chinese medicine. I am actually the president of the Florida State Oriental Medical Association here in this state, and we have been proposed with that from physical therapy, from chiropractic, practicing acupuncture as well. We believe dry needling is just another form of what we would call acupuncture or local acupuncture, is treating specific trigger points in the body instead of trying to find where organ system imbalances exist and this tying up of these energetic highways to dry needling. We just really say it's just acupuncture, just another name for acupuncture.
Very cool. Do you offer any other services besides acupuncture in your office?
Yes, we do. Chinese medicine has 5 main foundations that we utilize. One is traditional Chinese herbal medicine, acupuncture, exercise therapy, like you probably heard of Tai Chi or Qigong medicine. We have nutrition, which has always been our foundation in the medicine. And then one other that not a lot of people know about is called Cui Na, which is like a Chinese body work. If you were to take a massage therapist, an orthopedic surgeon, and maybe a chiropractic physician and mold them all up into one person, you'd have a Chinese body worker in China. So that is, we don't do that in my office. Certainly acupuncture, nutritional recommendations, lifestyle medications, herbal medicine. As a pharmacist, I love the herbs probably out of everything, and acupuncture.
And you've mentioned arthritis, but what other medical conditions are best treated with acupuncture?
Wow, it's kind of like a little bit of Pandora's box. 2,500, I say this to people just logically, 2,500 years ago when traditional Chinese medicine, was in its prime, the Han Dynasty, the Tang Dynasty, we had cancers, we had high blood pressure, we had diabetes, we had a lot of other modalities. We didn't have that name, we didn't know what that was, but we had to have treatments for those. So today you pick your battles, right? A lot of people specialize acupuncture, like my specialization and my doctorate was women's health. So when a woman comes into me, I get a lot of infertility. I have a lot of dysmenorrhea. I have a lot of menopausal type symptoms, but and sometimes even hormonal imbalances that are treated. But yeah, it's a whole gamut.
So osteoarthritis, carpal tunnel syndrome, high blood pressure. What about endocrinologic diseases, thyroid disease, diabetes? Does
Right.
acupuncture help that?
So we've always been under the premise, and I've always been trained, we don't treat a Western defined disease name. So what we're looking for is the imbalance. So for instance, someone comes to me, cold hands, cold feet, gaining weight, dry skin, constipation, brain fog, sluggishness in the body. And we say, wow, that person is really cold internally. Their landscape, their garden is really cold. But if you take their TSH or T3 or T4, you'll find out, wow, it might be subclinical hypothyroid. So we don't treat thyroid, but if we balance that person's constitution, then the endocrine system will kind of balance itself. And so that's the way we kind of think about disease, not in a way of treating like, how do you treat hypertension? What is a hypertension coming from? which we really do in Western medicine too, right? We do portal hypertension, nephrotic hypertension, we do cardiovascular, pulmonary hypertension, right? So it's really trying to find the source of the imbalance for us.
So it's a blend then of Eastern medicine and what we practice, allopathic medicine.
Exactly. You know, in China, when you go to China, even when I was doing my residencies there, I remember sitting with this one physician in internal medicine, and she had seen this gentleman for a rash. And I said to her in Chinese, I was like, what about this combination of herbs to treat the itching, the swelling? That she goes, old man. And I was like, you just called me an old man? She goes, prednisone. So she gave, methylprednisolone, of course, for the rash. So that's a blend in China. A lot of the hospitals have, that triage is, okay, go to the acupuncture clinic, or go to cardiology, or go to here or here in the hospital, or go to have herbal medicine, or go to the pharmacy and get this drug. So they're kind of triaging the best of Eastern and Western medicine there.
That's awesome.
Okay. Any other questions?
I think maybe just the last question. What would you say to people who are curious but a little bit nervous about having needles put in their skin for acupuncture?
Oh my gosh, yes. That's probably the number one fear and myth too about having acupuncture done, is that who likes getting their blood drawn, or getting, a hypodermic put into them? Of course, there's cutting and pinching and, pain with that. Acupuncture needles are solid. They're filiform needles. They don't have a bevel. They don't cut the skin. They just literally separate the skin. So we're talking very, very fine gauges, 34, 36, 38 gauge needles. And when you experience that, sometimes you get a feeling of pressure, sometimes a little feeling of warmth, of tingling, but the philosophy that an acupuncture needle is very, very painful, it's because of our concept of needling, but you have to actually jump outside the box and experience that, and be amazed, as most people are. When I put a needle in, then they're like, is it in? Is it in? And I, oh my gosh, it's in.
So we could have titled the show, It's Not a Spinal Tap.
Yes, yes, that'd be a good title.
It's been a pleasure having you.
Nice to be here.
Yeah.
Thank you very much for
Thank you,
inviting
Dr.
me.
Shipe. I'm Ira Pearlstine. This is Leah Ginn, my co-host, and thank you for watching another episode of Preserve Health Talks.
Thank you.